Hi, it's Raquel with the Warrior Mastery Method, and today I have the opportunity of interviewing Sara Dietzel, who is a licensed marriage and family therapist in private practice in Northern California, in the East Bay. Sarah's also a trainer of therapists, so she ultimately facilitates, helping support individuals who are interested in learning other techniques to help their patients. She also specializes in EMDR, and she does a lot of work around trauma. One of the reasons why I was so compelled to speak with Sara with respect to EMDR was to not only better understand it, but how EMDR might fit in with our conversation about healthy living as well as chronic pain management. So with that, hi Sara, and thank you so much for joining me.
Hi there, thanks for having me.
Absolutely. So why don't we get started? I really want to just talk with you. As you well know, I work with people who live with chronic pain, who are really interested in thinking outside of the pillbox, and who are really passionate about changing their quality of life. How could you maybe speak with us about how chronic pain comes up, in your space with EMDR, and then maybe we can just start talking a little bit more about what EMDR really is and why people might want to know about it.
Okay, yeah, sure. So I specialize in EMDR, so a lot of people come to me knowing a little about it and knowing they're coming to work through often past traumas. So EMDR was sort of originally looked at as a treatment for post-traumatic stress disorder, and anyone who's been in from all types of traumas, from a single incident trauma, a car accident, or an assault or something like that, or more complex trauma for people that have had maybe childhood abuse, things like that. So what I find, especially with folks that come in with childhood trauma, which I see a lot of, is along with the trauma comes chronic pain, unexplained chronic pain. It's often, I have, this, a fibromyalgia diagnosis or just ongoing body discomfort. And it can be bodily kind of joint chronic pain. It can be stomach problems, but it's manifesting somehow in the body. Their traumas, there's just a really high correlation of that. There's a high correlation of trauma and autoimmune disease as well.
Exactly. And I find it so fascinating in, the research I've done regarding EMDR, and my uncle also is a therapist in New Mexico. I find it so fascinating that something like EMDR can help people with what appears to be such a diverse diagnosis, right? You might have somebody who has been diagnosed with PTSD or with ADHD. Maybe somebody has been diagnosed with fibromyalgia, or maybe has an eating disorder. And what is it about EMDR that is able to support such a vastly different population in terms of people who might come to see you?
Okay, so let me tell you just what's sort of different about EMDR.
Sure.
Because what EMDR does is it really helps process. It's like they call it, an adaptive information processing system. It allows negative body sensations, emotions, and beliefs or thoughts, cognitions to be worked through, so they're not held so much in the body. So we go through life with upsetting or disturbing or traumatic experiences. Well, what happens often is those experiences sort of get frozen in time in the nervous system. It's like when you get triggered, it's like it's happening again, right? Your heart starts racing, or you start sweating, whatever it might be, like you're in that panic, that fight or flight or freeze mode. So what EMDR does is, sometimes what happens often is people will come to me and they're like, I know I'm safe now. Like, I'm not in that unsafe circumstance anymore. I'm not living with a dangerous person anymore, or whatever, an abusive person. It might not, that's not my life anymore, but I can't feel that. Like, I know I'm not, unsafe, but I feel unsafe and my body is tight and I'm, having pain, whatever it might be. And that's because when you have those upsetting and disturbing or traumatic experiences, it gets trapped. So that's why like talk therapy can be helpful in like understanding, oh, that's not true anymore. I'm no longer in that situation. I'm safe now. But your body doesn't react or respond. It still triggers. It still holds the bodily and emotional discomforts. What EMDR does is it allows you to process that out. So the discomfort and the so you no longer get triggered. So what now becomes true in your body and in your emotional system as well.
Yeah,
it allows you to let go of that.
And I think that letting go is so profound because oftentimes that trauma, that experience, it can have such a grip on you,
right?
And it's manifesting, it can very easily begin to manifest in so many other things. And before you know it, something that happened maybe so long ago is negatively affecting your quality of life today.
Right. And sometimes it's hard to link that up. Like you don't realize that. Like, sometimes you do because you have memories that continue to flash up in your mind or nightmares that continue to flash up that are connected to something. But often sometimes, I've had people come to me before that are having tremendous anxiety, let's say driving. And so you would think it would be a driving incident. But when we do the work and really check in with the body and the emotional system, and what they're believing about themselves, we light those 3 neural networks and we trace it back in time. Sometimes it's linked to something different. So I've had people have anxiety about driving, but when we really figure it out, and EMDR has a technique for doing that, it's connected to medical trauma.
Interesting.
Because what happened was the anxiety showing up in the car of something bad's going to happen, I'm in danger, like that belief, and the body's feeling panicked. So it's triggering the body sensation and the emotion, but like the experiences don't necessarily seem like they would link up. So sometimes that can be confusing for people.
Yeah, no, absolutely. I want to talk a little bit about warriors, and what I mean by that, I define, as a yoga instructor, right, there's a number of different variations of warrior pose, but having lived with chronic pain and working with my clients, I really find that warriors are individuals who are in some type of internal physical, emotional, maybe psychological struggle or conflict. Right. And I think it's just incredibly courageous when people are able to, embark on that journey of really, finding that resolution with that conflict or that internal turmoil. Can you share either a personal experience or maybe share, some work that you have done where you have seen, again, like, something that we can really pinpoint how the work, working with you, EMDR, how that really, brought to light how this, holding on to that experience in the physical realm was maybe manifesting, and maybe there was some kind of pain transformation or pain release.
Right. Yes. So it is not uncommon that once you work through someone's traumatic experiences with the processing that lets you go, lets it work through the emotional system and the body, that the pain actually goes away or significantly reduces. But it would not be uncommon for someone to have been struggling with a certain pain. In fact, you may experience something, let's say somebody was assaulted and now they were held down in a certain way. Well, the pain might be alive right in that part of the body. And so when we process the assault, and once that, move through, that pain is now gone. So that's not an uncommon experience, or at least, tremendously reduced. It sort of depends. If someone's had a lot of trauma, a lot of complex trauma, it takes more time and it's more complex and it's more difficult. But it would not be uncommon for me to do someone's work, go through their history and help them with EMDR. And for them to no longer have pain.
And I know that you, in terms of your work with EMDR, you you work around an attachment focused EMDR. Can
Yeah.
you share really what that is?
Yeah. So there's different kind of, people have sort of their own ways and their own adaptations to the original EMDR, who was discovered by Francine Shapiro. And so I work for the Parnell Institute. So I work under Laurel Parnell, and she has modified the EMDR to what she has titled attachment focused EMDR. So part of that is really modifying the protocol so it's more comforting for people, so it's more client centered. But
Mm-hmm.
also she's added a whole element called resourcing.
Mm-hmm.
And so so often people that have had trauma, or just people, right? Life has its challenges, have a lack of a sense of nurturing or protection or
Mm-hmm.
wisdom. So we basically use the imagination and incorporate these resources. So we will do a peaceful place. We will do nurturing figures and the nurturing qualities of that nurturing figure, and have people really feel that and bring that in. They can be real or imagined. Protective figures, that's a big deal for someone who's had childhood abuse. And then also wisdom. And so we work around using the bilateral stimulation and basically sort of installing into the nervous system these positive resources.
Mm-hmm.
Because the thing that's so difficult, right, is especially the more traumatized, and if you're in a lot of pain, we don't attend to naturally. We're designed to survive. So human beings attend to negative stimuli much better than positive or neutral stimuli. And so this allows to bring awareness to, right? There can be 10 things going on that are positive and one negative, and we get stuck on the one negative, right?
Yeah.
So it's bringing awareness and creating new neural networks of a sense, so by a felt sense of nurturing and protection and wisdom, and
Mm-hmm.
bringing that into the whole process even before we do trauma processing. That in and of itself is so healing.
Mm-hmm.
We do a lot of things with that. And we use the bilateral stimulation to tap it in and strengthen it, and that is the big piece of attachment focused EMDR. And we would allow for other positive experiences. Like, for example, you might create some sense of like a really positive, nurturing, healing resource in, like, let's say it could be a grandmother, or it could be a mama bear, it could be your dog, it could be anything where you really get that sense of that, and we take that in. Now bring that healing sense to your pain. I mean, that would be something where you would modify and change things a little bit. So you're like nurturing and taking care of the pain.
Yeah.
So that's just like a little protocol piece you might try.
And I do want to ask you, if you wouldn't mind, can you elaborate more regarding the bilateral stimulation in terms of,
Right.
to hear and to just try to imagine what that might be and how that ties into, the attachment focused EMDR itself.
Okay. So what bilateral stimulation is it was originally what Francine Shapiro discovered was that by moving her eyes back and forth, and she did a bunch of research on this, by people moving their eyes back and forth, it would allow them to process information, and it would become less disturbing after they did that. So if you took a memory and you moved your eyes back and forth, it would be less disturbing afterwards. It's sort of emulating what your brain naturally does during REM sleep. Your brain's it's integrating left and right hemisphere, right? So but we've adapted that. Some people do eye movements, but typically those of us, I mean, it's not that I wouldn't if it really somebody wanted to, or it was helpful in some way, but typically in attachment focused EMDR, we're using tappers.
Mm-hmm.
So there's these little tappers that you hold in your hand, and they just sort of like buzz side to side. And so you hold them in your hand and they sort of buzz side to side. You can also do sounds, and the sounds, it's just like you have a headphone on, and the sounds go side to side. And for some reason, that bilateral stimulation and the dual awareness that creates when you're processing a memory allows it to move through. On some level, it sounds a little wacky. It's amazing though. And there's so much research behind it now, over 20 years of really
And
unbelievable
when you say it's allowed to move through, are you saying that emotion, that memory, it's allowed to move through the central nervous system, the physical body?
Yeah, I kind of, when I say move through, I mean it's allowed to leave in a sense, allowed to leave your body. Yeah.
Kind of purging.
Yeah. Yeah. So let's say you had, somebody had, let's see, a particular, okay, this is something that can happen. Let's say someone had an assault or a really difficult experience in a certain part of town, like I can imagine, I can think of some things like maybe by their school or something. They got beat up, they were bullied. And so now every time they go down that street, whoo, right, their body floods, they feel panicked, they feel triggered because there's that place where this happened. So
Yes.
that's the body reaction, even though they know I'm safe, I'm okay, that was 10 years ago, I'm in control now, I'm not powerless. They know all those things. Their body goes into panic, right? And they feel scared and fearful and terror and all of that. It allows that to go. So now you can go past that place and not have that strong reaction anymore. That's what I mean. It leaves.
So what could somebody expect in terms of, the duration of time working with you? Do you find that everyone is just so uniquely different, or their journey is so uniquely different? Or do you find that for the most part, let's say somebody who had, like you said, maybe a one time, they had a car accident, maybe there was an assault, versus somebody who grew up around, or grew up with physical abuse or what have you. Can you talk a little bit about that?
Yes, so that can really vary. So somebody has a single incident trauma, like a car accident or an assault or something, and their background is rather stable, like they had like a loving, nurturing relationships and childhood for the most part, nothing's ever perfect, then EMDR is very quick. That would just be, it could be as few as 3 sessions. Maybe more, but it could be as few as 3 sessions. But someone who has had a lot of childhood trauma, and especially the older they get, the longer it's kind of this has been wired into their system, it could take a really long time. And then somewhere in between. So it wouldn't be uncommon to someone had a pretty complicated childhood, but yet they're pretty high functioning now. They were able to overcome and have relationships and hold a job and things like that. Those folks, wouldn't be uncommon to be with them 6 months, a year, maybe more, but somewhere in there. But if you had someone who had years and years and years of very abusive trauma, then that's not going to be the case. It's going to take a lot longer.
I understand. Okay.
But as far as comparing it to regular talk therapy, it's much more efficient, or psychoanalysis or something that you're on the couch for 20 years. Yeah.
I do want to ask you this. I would love to just hear, just in terms of, your background working with your clients, your own research, how would you define chronic pain?
Okay. So I'm not 100% sure what you're looking for, but what comes into me.
That's what I mean.
Coming in saying, I've got aches and pains, nerve pain, joint pain. I can't move or as much as I used to be able to do. Yes, that is like, I feel like that's kind of a lot. Just muscle, joint, ache, and nerve pain would be sort of what often comes in. Now with trauma, you can have people with chronic stomach problems too. That's really caused them a lot of grief as far as pain, but also just struggling with function. Yeah. Yeah, I know there's and sometimes it's very unexplained. Other people come in. I've had people come in because they had, and I'm glad I just thought of this one. I had someone that came in and had to have their leg amputated because of an accident. Well, it was very painful, but there is a medical reason why it was painful. It was known. The EMDR still helped tremendously in managing, once we process the trauma of the motorcycle accident. And, then the EMDR is helpful in reducing the pain because there's so much anxiety from the trauma, right? That if we can take the anxiety and the charge and the body sensation, emotion from the trauma, then the body relaxes and can kind of handle the pain better. And you can also help people feel differently about that. How they're perceiving their pain sometimes can be really irrational, and not intentionally, but it can be so complicated.
No, absolutely. I know in working with clients who again are trying to get healthier, they're trying to just really get back in the driver's seat of their life, right? They've been really shadowed by chronic pain, and we'll start working together, and things really start to come up. And what I have found, kind of a very common theme is this chronic pain will start, and maybe right before, maybe a year or two before that chronic pain started, that individual could have experienced the loss of a loved one. Maybe they lost their house, with the recession, or there's really emotional, very difficult things that they had to experience. And then they find themselves, either being diagnosed with chronic pain, or, chronic pain syndrome, or, they have low back pain. And, they might think that it's, from, sitting too much at work, or what have you. And what I have found, because I do believe that it takes a village, right? Like I always, part of, one of the pillars in my program in working with people is really to support people to align themselves with their healing team, right? Like it's not going to just me. It's not going to just be me. It won't necessarily just be a bottle of pain medicine, but it really takes a team. And my point is really just trying to convey to people that sometimes, in terms of chronic pain, to better understand how to let go of maybe that past trauma, and to really start to do that work. And how could we maybe complement that healing journey, right? And I'm really just so thrilled that, you are now, like, in my circle of influence, for lack of a better word, to just try to help, support people and get to that, just really get to the root of where that healing might need to start. So,
right. And I think too, like just thinking about like Bessel van der Kolk's book, The Body Keeps the Score, right?
Yes.
He's a trauma expert, and he titled his book that. So that tells you something about how the body really holds trauma and holds, you know, negative experiences, upsetting, disturbing experiences. And sometimes and since EMDR is a body therapy, like it has that, we focus on that. It allows, sometimes I can just work with the body, like the body has the message. The body is holding the trauma. The body can tell you. We can focus on that. We have ways of doing that with EMDR, that they can really find the message of where the trauma is and why it's being held in the body.
Yeah,
it's pretty miraculous. And sometimes that pain is being held, and you kind of check in with it, and it's sort of there for a reason, like it deserves attention or something. There's lots of complicated layers and ways of unraveling what's happening with the body and why it's holding the pain.
Yeah. So in the event that somebody works with a therapist, somebody like you who helps really create these transformations and these, healing, like experience these amazing healing journeys, would an individual, would you find that individual would maybe have to, come back, or like once that work is done, it's done? Like
typically once you do the trauma work, like you process something out, it doesn't come back. Or you take a dream or a nightmare that you're having and you work that through, it doesn't come back. That doesn't come back. Other things can surface, and there's other, there's working the traumas out, and they really don't with EMDR. It's my experience that once you work that one out, it doesn't return. It's kind of like once you have something that just kind of just bugs you a lot, and it comes up a lot, and it's just on your mind a lot. Well, you do the EMDR work, and 2 weeks later you're like, it's just not bugging me anymore. It's just not there. It's not alive in me anymore. It's like I've had people say things like it feels far away. It feels like deep down a well. It feels like it's up on the bookshelf now. It's not like it didn't happen. We don't take memories away, but it's not alive in me anymore. It's not tight in me anymore.
Yeah.
It's just a memory now.
Yeah, and having, you know, although I've never worked with you personally, but I do know, you know, two close, very personal friends who have, and I know just in terms of being in their world, and I'm happy to share that there has been such a profound transformation in how these individuals really just relate, you know, to just the world, and there's just so much more joy and happiness. And having, you know these two individuals very personally, it's just such a pleasure to be able to see them enjoy their life so much more now. And when you live with chronic pain, to be able to find joy is very difficult when you're really shadowed by pain. Yeah, exactly. So for that, I thank you just from the bottom of my heart, because I know you've made such a profound impact on their lives. So thank you for that. So I appreciate your time so much. I really hope, my intention has been to think outside of the pillbox, help people in chronic pain think outside of the pillbox, and hopefully now understand how EMDR, maybe attachment-focused EMDR or bilateral stimulation can maybe come into their consciousness of how to think outside of the pillbox, how to feel better and live with more joy. So thank you so much, Sara. I really appreciate talking with you today.